Hello and welcome. You're watching NewsX with me, Devika Chopra. At least 16 children are battling for their lives, while 10 newborns have died after a fire broke out at a hospital in Uttar Pradesh's Jhansi. The fire erupted in the Maharani Laxmi Medical College's neonatal intensive care unit at 10:40 p.m. At least 54 children had been admitted to the NICU at that time. So far, 7 bodies of the 10 babies who have been killed have been identified. Authorities believe that an electric short circuit in the oxygen concentrator at the hospital ignited the fire. The fire extinguishers had expired in 2020 and even the fire alarms did not ring. It took a whole of 2 hours for the fire to be put out. Officials as well as parents leaped into action to save lives of the infants. Parents are now voicing concerns about not being able to identify their babies, with some even alleging that their newborns had been taken by another family. DNA paternity testing is being demanded to ensure families correctly reunite with their children. But the question really arises, who is responsible for this tragedy? I'm going to put out some photographs that have now come of the incident. Look at the fire and the extent of the fire that took place in Jhansi. Okay, so these are visuals from the hospital and you can see the way the fire had engulfed an entire neonatal intensive care unit. These are visuals of parents working with the fire authorities, with cops trying to go into the NICU at night to try and save their newborns. Look at this, stretchers, hundreds of people gathered and stretchers after stretchers being brought in to bring out the bodies and to bring out the children who were still alive. Parents, there was utter chaos at the hospital. So these are of course visuals that came in from last night of parents looking for their children. Look at this. Just mothers sitting together, not knowing what to do. How tragic. Parents now, once again, just complete chaos at the entrance of the hospital. But this is the most unfortunate and the most perhaps telling visual of what has happened. This was the NICU in the Jhansi Medical College last night. Look at the extent of the fire. Officials are claiming that this fire was caused by an electrical short circuit, which ultimately engulfed the entire NICU. This is the aftermath of what has taken place. Your beds destroyed, incubators destroyed, the entire NICU absolutely destroyed. 10 newborn children lost their lives over what the authorities want us to believe was an electrical short circuit. What's worse is perhaps the politics that has now started over the entire incident, but once again telling visuals and videos circulated by the Congress party, which says that hospital authorities came up to spruce up the hospital because Uttar Pradesh Deputy Chief Minister was about to visit to look into the matter. This is the state of affairs. Who's responsible? No one has an answer right now, but we will try to take that conversation forward. I have with me Mr. Ranjan Dwivedi, former DG of UP Police, Dr. D.K. Gupta, Chairman and Director of Felix Hospital, A.K. Dubey, Senior Lawyer and an AOR of the Supreme Court, and Mr. J.K. Singh, former Director of UP Fire Services, with us on the broadcast. Let me begin this conversation with Mr. J.K. Singh. Mr. Singh, as per the initial investigation, we are now learning that the fire extinguishers were in fact expired. That this is not the first fire that has broken out in a hospital, nor is it the first fire that's broken out in a building which has led to the loss of life. what is it or why is it that we continue to suffer from this epidemic in our brains, which is a stubbornness to just follow the rules?
See, are you able to listen me?
Yes.
Okay. Let us take a broader picture of it. It is not the fire, not focusing on the only fire extinguishers. Rather, the fire prevention and life safety is the basic function of the sustainable developmental process. The sustainable developmental process, which is now we are coming up with, we are focusing upon it. In this, fire safety is inbuilt, fire prevention and life safety. Now, first question arises that why should there be a fire? How the fire was initiated, may it be the electrical short circuit or many more other reasons.
No, of course. The first question is why the fire erupted, of course.
If there be an initiation of the fire, then the spreadability of the fire has to be curtailed. The second step is the spreadability of the fire. And third is the evacuation, escape and evacuation. May there be a horizontal evacuation or the vertical evacuation, especially the center sensitive like neonatal care units, prisons, or the your mental asylums, where the people themselves cannot escape. There has to be a facility to move them from one place to other. Many hospitals we might have witnessed that there are horizontal space available where the patients are admitted. In front of the side, the horizontal space, horizontal reserve space is being left. So there is the possibility of the horizontal evacuation of the patients. Similarly, in this hospital, there was a short circuit. If the fire is in a corner, the spread of the smoke is very fast. And the whole hall was locked with the smoke. So, in such cases, the fire prevention takes the paramount importance. There should have not been, or there are many safety devices, circuit breakers, which could have averted this particular incident. And for this, the fire safety order, regular fire safety orders, there are certain periods which some of the points may be seen annually, some of them on 6 monthly, some of them the monthly, and many points which has to be observed every day. If there be a system involved in this.
Okay, but I want to bring in Ranjan Dwivedi into the conversation. Mr. Ranjan Dwivedi, who then has to be held accountable for what has happened? And it can't be just, there are reports now coming out that a nurse was lighting a match near the oxygen concentrator, which resulted in the fire. Absolutely bizarre claims coming out of this entire investigation. Why is it that we are always, I would say almost in 100% cases, unable to really make an impactful arrest in such cases, so that nobody else who comes at the top in the administration is able to get away with this? Because right now we're talking about it from a very technical aspect कि आग लग गई, आग नहीं लगी, बच्चे मर गए लोगों के, and nobody is being able to understand that or grasp that reality.
Yeah, Devika, it's a very sad incident. It's really sad that so many children are no more, and many would be also affected for life. Now, we can approach the problem in two ways. One is a blame game. Who's responsible? And and a bureaucratic answer would be that it's an inquiry which will show who's responsible. And what will the inquiry be? The hospital will say we asked for a budget, we never got it, so we never got the extinguishers changed. Finance will say we didn't have enough money, and so we'll go into a quagmire. Now, what I would like to request here is that instead, let's see what should be done in the future. And here there are just 3-4 points I'd like to bring to your notice. One, that there's a concept called safety by design. Now, what does safety by design mean? That you have standards for hospitals which ensure measures like what Mr. J.K. Singh mentioned. But besides that, besides the building itself, what are the materials used inside? All hospitals have these Dunlop foam, or these foam mattresses, which are very, very inflammable. So what mattress you should have, what curtains you should have fire resistant material, fire resistant wood, fire resistant mattresses, bed sheets, and so on. Then secondly, you know, some a fire drill is something doesn't cost money. When is a fire drill done? Has it done regularly? Having checks on that. And what's most important is, which I'd like to point out, that I think the entire structure of governance of our hospitals has to change. And why do I say that? See, the hospitals caters to the proximate community. The proximate community would never have a problem giving money for a hospital, provided the money is spent properly. Now, if you say we are taxing and then it goes to the state, and the budget comes from there and so on, it's too long-winded. I think what is needed is administration should change the structure of governance. We should have local communities managing hospitals, and or what is it they're required to do? You have people who will contribute and themselves supervise the construction or whatever materials are required. So money will come from the people, money will be spent by the people, and it will be audited by the people. And once we do this, I'm sure it will have a huge impact on the way our hospitals function, and schools function, and so many local facilities that the local community uses. Gone are the days when you say, you have somebody sitting in the state capital and trying to say that, do this, do that, and so on. And, this will never happen. You have a tragedy here, there's several tragedies, smaller ones that keep on happening. And I wouldn't be surprised that you'll have another one. Why? Because the fire extinguisher wasn't changed, or there was a short circuit, the electric connection wasn't changed. And there's one other important point I'd like to mention. We need to be quality conscious. We're not quality conscious. If there's a wire break, we'll have a loose twisting of the wire without its proper taping. Kaam chal raha hai, chalne do usko. So, we have to be quality conscious, and there has to be a regular inspection of things. And unless this discipline and this quality consciousness is brought about, this would not be the last incident we are seeing of this nature.
Okay, I want to bring in A.K. Dubey into the conversation. A.K. Dubey, how does one then instill the fear of God in the people from top to bottom who are responsible for what has happened? Because it seems as though it is this lack of fear of God itself which results in this mindset of jab tak chal raha hai to chalne do.
Devika, it's a very unfortunate, sad incident. And apathy is that we are still struggling to have the basic amenities. On the one hand, we are talking about that country is progressing. We are going to become the 5th largest economy of the world. On the contrary, every day, one to the other, in one part of the India, we have a Upahar-like tragedy. What changed after Upahar? Devika, you see nothing. Few years back, you remember, Devika, dozens of newborn died in Gorakhpur hospital due to oxygen. Now died because of no fire safety measures there. And that too in a medical college. It's not the hospital only, Devika. It's the complete system which is negligent here. Be it the fire department, be it the check and balance authorities which are responsible to look into it. This shows our poor, lethargic, regulatory non-compliances in check and balance by law enforcement agencies. We keep talking that Upahar tragedy should not be defeated. Numbers of judgment, hundreds of pages of judgment we have seen Upahar cases. What changed? If we see the Jhansi, then we see nothing changed. Right to safety is a fundamental right. But here we see it's a complete violation of fundamental rights, and it's a lawlessness. Why I call it lawlessness? It's not only law and order situation, but it's more than that. See, the NBC 2016 recognized that the safety of life is more than a matter of means of ingress. And there is a law in place, the Fire Prevention and Fire Safety Act 2005. What happened to that department? when there is a Fire Services Act is to prevent the fire tragedies and to have a fire safety measures at place in the buildings. But what is this law? What happened? Toothless law? Of course. Where is just asking that we will have a probe? Probe report will come. When will come, the new incident will come. There is a checklist, Devika. I was going through what are the parameters to checklist for the hospital fire safety. One is the perform scheduled fire risk assessments to identify the potential hazards, evaluate existing fire safety measures and pinpoints areas for enhancement. But where is the Department of JK Singh is working? Of course not. Ensure all hospitals facilities comply with the National Fire Protection Association. What happened? Newborn died. Provide regular fire safety training for all staff members. Have we seen that any fire safety training had happened in Jhansi? This should include the fire prevention these practices, evacuation procedures, and how to prevent fire. Where is the reliable fire alarm systems, which is to be installed throughout the hospital? Where is the fire extinguishers and other firefighting? What is the
Okay, we seem to be
sorry, negligent act.
we seem to be losing the line with A.K. Dubey. I'll come back to you, Dr. D.K. Gupta. I want to bring you into the conversation. Dr. Gupta, why do you think such incidents in a majority continue to come out of government hospitals? What is it that private hospitals are doing that is so drastically and dramatically different from government hospitals, or that is so different that it can't be replicated? It's a matter of having a system in place, and one can always look at the system in place in a private hospital and aim to replicate it. Why is it that we are failing to simply do that?
David, will differ from your point of view. Fire safety is extremely important in all buildings, especially hospital building, being private or government. I think we all should follow the SOPs and protocols in our hospital so that we can save lives and we cannot danger whatever patients are admitted in our hospitals. If we talk about the fire safety and protocol, I think most of the people have been discussed already. But definitely, I will tell you that there are specific guidelines in NBC, National Building Code, that general hospitals there should be fire alarms detections, and fire alarms should be installed and tested regularly. Smoke detector in all coastal areas should be there. They should be functional. Manual alarm system should be there. Fire extinguisher should be working in all areas. All staff, I think the most important area where we are missing even in private hospital or government hospital, that is training is most important area where we are not.
No, but Dr. D.K. Gupta, I am saying that the theory is in place. We know the theory of it. What I am trying to understand is
like implementation.
Why are government hospitals not then being able to simply replicate the way private hospitals have structured themselves? Is that a conversation that we then need to have in our country? Because our healthcare system otherwise is not broken. Private hospitals are doing extremely well, but everybody can't afford the private hospitals. That doesn't mean that just because someone is poor, they are thrown in the dumps the way they were in Jhansi. You have to see the visuals to feel for the people, because you see parents and family members entering the NICU and bringing out charred bodies of newborn babies. So I'm just trying to understand, why is it that our government hospital machinery is suffering so much, and over the years we've not been able to fix it?
If we talk about the private hospital, the top management is highly sensitized about these types of incidents. They are purely working on the quality and safety of the patient. Our core value is quality of care and patient safety. These are two most critical areas where we are working in all hospitals. Even NIBH says that quality and safety is one of the most prime areas where every hospital, being a private or government, should work, I think. The second point, in private hospital, system, process, structure, SOP, they are all implemented fully. People are accountable for those. Their responsibility is dedicated. KRA and KPI are mapped also. There is MIS of all the areas for routine checkup and weekly, monthly MIS. There.
Yes.
Even external auditor are there to check all these things. I think this is lacking in the government hospital because of lack of resources, lack of budget, lack of billing list, lack of political bill, lack of bureaucratic bill, or lack of management bill.
But really,
we have all system and process.
Yes, but I want to bring Mr. Ranjan Dwivedi back into the conversation. Mr. Dwivedi, are the budgets really lacking so much as far as government hospitals are concerned? Yes, I understand that private hospitals are making a lot of money, absolutely, 100%. And they do possibly have access to way more resources, also human resource. But are the government hospital budgets so low that you can't even do a safety check on your fire systems?
There's just 3-4 points I'd like to mention here. Firstly, it's not a true statement that incidents do not happen in private hospital.
Mr. Dwivedi, I'm going to have to ask you to unmute yourself, sir.
Oh, no, I'm not. I have not muted myself. Can you hear me?
Yes, we can hear you, sir. And you said that no, I never made a statement that incidents don't happen in private hospitals. I'm talking about the ratio of incidents, sir.
So
I'm talking about the ratio of incidents.
Yeah, so I'm just coming to it. That incidents happen in private hospitals too. One, then you have a range of hospitals, a small hospital to a corporate hospital to a private clinic, a doctor running something in his own household, and so on. Similarly, you have a primary health center, CHC, and so on. So there's a range of scenarios talking about, and these incidents typically happen in very, very large cities where there are many people and a lot is at stake. But remember, I mentioned we have a culture which lacks quality consciousness. Even in the private hospitals, you find people cutting corners. Not that they don't do this kind of a thing. It's happening here. It's happening there. Government, then see, private hospitals, they can charge the patient for whatever they spend on public safety. Here it's more complicated. Here it comes via a taxation system that the money comes in for paying for your safety systems. And it doesn't translate that way, unfortunately. As I said, that this inquiry, when you get into it, the hospital will say we asked for money for rewiring, we never got it. Finance will say we never had the money. So I'm saying, we'll go into a labyrinth of questions without coming to any answers, and this whole thing will die in 5 years. And as my colleague, my friend Ashwini said, that after Upahar, have we learnt any lessons? Well, Ashwini, we have learnt lessons all right, because Upahar was many years ago. And there's another important point. Please note. You see, the fire service department usually is more stringent and forthcoming when it comes to the private systems. When it comes to hospital systems, a lot of brotherhood gets involved. नहीं ये अरे हम करा देंगे इसको लिखिए मत ऐसा हो जाएगा अस्पताल बंद हो जाएगा. If fire systems are not working properly in private hospital, the chief fire officer will say it's not working, please shut down the hospital. No, you can't start the hospital unless you have it in place. Will be followed. But this kind of a thing cannot be done in a private, in a Sarkari hospital. In a government hospital, you can't shut the hospital. So, implementation of the laws, even by the law enforcement agency, becomes a lot more difficult when you come to a governmental system. So, but yes. I said that, and which is why I said we need to move on to a governance structure where the local community which is affected, and mind you, community is never shy of giving money, provided the money is spent properly. No, you can't have people contributing that the CMO will spend. No, they'll never do it. But you have a system, and some initiative has been taken by doctors at a local level, government doctors at local level in government institutes, where they mobilize the community. Okay, you get the money, you buy the stuff, you install it yourself, you maintain it yourself, audit yourself. We'll not get into it, and you have systems working perfectly over there.
Yes.
So I think the government has to really get into the system and change the structure of, UP is such a large state. If it was a country, it would be the 5th largest country in the world. Now, mind you, this is the size we're talking about. And if you think sitting from Lucknow, you can manage things in Jhansi and Lalitpur, which is, 300-400 miles away. This will never happen. We have to move to a structure where governance is placed in the hands of society, people who are most affected, and locally.
Okay, all right. I've run out of time, but I thank all of our panelists to join us with their thoughts on what has happened in Uttar Pradesh. On that note, viewers, we step into a very short break.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.